9:46. I am in Studio 61 to meet with Dr. Syed Hussein from Trinity Health of New England, who takes time out of his busy schedule to answer a lot of our health-related questions every time this week, right around now. Doctor, good to see you again.
Good to see you too.
And as always, we're usually talking about COVID, we're talking about flu, and now, according to the state surveillance, we're finally starting to see a pretty big uptick in both compared to where we were with both the past couple of years.
Yeah, Tim, so you'll recall a few weeks ago, we just had 2 states. Now, nationwide, we have 17 states, including neighboring New York City, that are exhibiting high or very high flu activity. And within the state now, more locally, we have New Haven County, Hartford, Wyndham, Tolland, and Fairfield, again, proximity to New York City, that are exhibiting moderate flu-like activity. We do expect in the weeks to come that this will ramp up, and Connecticut will also turn into high or very high in terms of flu census.
Yeah, so we're seeing pretty much what we were expecting to see. Let's talk about the COVID booster, the bivalent booster. Do we have more data on how well it might be combating all of these new variants that are popping up?
Yeah, so new data released by Pfizer indicates that against the BA4 and BA5, again, these are the dominant strains so far in the country. There are newer variants now gaining ground. Nonetheless, the bivalent booster is supposed to boost immunity, antibody levels by up to 4 levels higher than the original COVID-19 vaccine. Now, what this means, though, is we still aren't seeing as many people as we should rolling up their sleeves and getting the booster. It's a little over 8% nationwide in terms of eligible people who've gotten the booster. So basic bottom line here is it's not too late. Holiday season is around the corner. Let's protect yourself and your loved ones as we prepare for those gatherings and get the booster shot along with the flu shot.
I'm guessing a lot of people are a lot less scared of dying from COVID than they have been in the past. So maybe that means the risk and the fear of long COVID might start to rise on up, as we're seeing a lot of people being debilitated for a long, long time, something we're not talking about nearly as much. But at least there might be some good news on that front with Paxlovid.
There is. There's a new study out done at the VA which shows 9,000 people out of 56,000 that were eligible to receive Paxlovid who had a 26% reduction in long COVID symptoms at 3 months from the study, which is promising. More studies are needed and more analysis is needed, but it shows that Paxlovid not only decreases risk of hospitalization and death, but also the risk of long COVID, which, you know, viewers need to be reminded that it can impact any organ system. Blood disorders, heart disease, lung disease, liver disease, kidney disease, neurocognitive impairment. So this is promising that Paxlovid can decrease the risk of long COVID.
And that was always going to be one of my worries, that because there's such a wide variety of long COVID symptoms that affect a different variety of systems in the body, how easy is it to try to treat all of them with sort of one medication like Paxlovid?
Yeah, it's a challenge for sure, but if there is a pill that works, especially in higher risk individuals, then it's promising.
All right, that is good. So we'll take any bit of good news we can get on this. Doctor, thank you so much for joining us again.
Thank you.
Good to see you as always, Dr. Syed Hussein from Trinity Health of New England.